Well, thank you for putting this conference together today. It's an honor to be here before you today and recognize the incredible contributions that Doctors Krantz and McClanahan had on us as professionals and the autism community at large. I would also like to take a moment to congratulate Anya and Ivona on 15 years of amazing intervention that you are providing to individuals with autism. Today, I will be presenting on teaching adolescents and young adults with autism to initiate bids for joint attention using multiple exemplar training and script fading procedures. Before we discuss joint attention, however, it's important to recognize that joint attention falls within the category of social interactions. We all know that social interaction is critically important to us as humans because we all desire social interaction with others. Social interaction is reinforcing, which sets up the occasion for us to have future interactions. And as Doctors Krantz McClanahan had stated, positive social interaction also leads to additional learning opportunities. We all know how important learning opportunities are, especially for individuals with autism, as every moment is a learning opportunity. This is important because we all know that individuals with autism have deficits as it relates to having meaningful and positive social interactions. Without the effective teaching strategies to remedy these deficits, individuals with autism could face pervasive and long-lasting effects. And while a lot of research has focused on the development of social skills for children with autism, these skills become much more complex and subtle as children become adolescents and adults, and the importance of ensuring prerequisite skills are in place at an early age becomes that much more important. To be able to teach social interactions in the most effective way possible, it is important to identify some key factors when teaching such a repertoire. Some of these factors include the attention to relevant social stimuli, the age appropriateness of the interactions, the relevant discriminative stimuli that should set the occasion for responding, or as we commonly talk about, stimulus control, and how one should respond under certain conditions, as social interactions are very complex and no two situations are ever exactly alike. And certainly, when we think of social interaction, we often only consider expressive language. While critically important, expressive language should not be the only focus of teaching appropriate social interactions. Nonverbal behavior is also critical to ensure social acceptability. As learner repertoires become more advanced, focusing on teaching skills such as appropriate facial expressions, gestures, body posture, social distance, which of course now has become even more prevalent these days, and teaching learners to discriminate others' display of these nonverbal components are all important factors. In sum, the combination of teaching to both verbal and nonverbal components of any social interaction leads to increases in overall pro-social behavior. And what I mean by pro-social behavior, it's really a broad class of responses that include aspects such as smiling, helping, making friends, and sharing, just to name a few. The greater attention to detail that we pay to these variables, the more interest social partners have in our learners. And again, the more success and positive experience our learners have, the greater the outcomes will ultimately be. One such example of a positive outcome is the opportunity to have shared experiences with others. To share a positive experience with someone is so important for us, again, as social beings. Again, as people, we desire social interaction and engage in social interactions and shared experiences with one another because of the reinforcers associated with those experiences and interactions. Shared experiences allow us to participate in new activities, After all, if you think about it, how boring would our lives be if we did the same things over and over every single day? New experiences provide us opportunities for various interactions. Those experiences help to promote the generalization of skills to be displayed across a variety of situation settings or across a variety of different individuals who you come in contact with. We could also then learn new skills, which ultimately helps us to become more independent and comfortable under those conditions. This helps to increase one's quality of life, which then results in someone leading a happy, productive, and fulfilled life. Of course, the social experiences we might have may vary based upon the relationships we have with people. So, the social experiences that we have at home with family members are certainly different than those relationships that we have in the work setting with colleagues, which are also different than those that we have with friends and other people in our environment. The more value any relationship has, the more that relationship, again, is paired with rewarding experiences and rewarding individuals. And then those in meaningful relationships are treated as equals. And that's really important. The same expectations that are set forth for both parties should be true in the same manner for the learners with whom we work. The disability of autism should not define the individual. We should set high standards and teach to those standards to help advance the skill sets of the individuals with whom we work. Autism should not stand in their way. We might just have to work a little bit harder to help each person achieve what is certainly possible. In teaching learners to have meaningful relationships, we have to consider these factors in order to help build upon more complex repertoires. So, for the remainder of this presentation, I'm going to provide an example of a research study that aimed to promote positive social interactions by way of shared experiences. Specifically, the goal of this study was to teach joint attention skills to adolescents and young adults with autism using multiple exemplar training and script fading procedures, as Dr. Venner and Dr. Gillis just previously mentioned. Joint attention is defined as coordinating attention between an item, an event, and a person in a social context. Joint attention typically develops in young children between 9 and 18 months of age, naturally, without any teaching. Joint attention is not a single skill, but it's comprised of a complex set of skills that includes, but it's not limited to, shifts in eye gaze, pointing, point following, showing items of interest, and verbal responses. Typically, a toy, event, or another item of interest and a communication partner are the relevant discriminative stimuli of a joint attention interaction episode in which attention is allocated between the item of interest or event and the social partner. So, if the item of interest and the social partner of a joint attention interaction episode are the relevant discriminative stimuli, the function of joint attention is social in that a person engages in joint attention for the natural social consequences that are involved. Of course, for individuals with autism, social consequences we know may not function as reinforcers as they do in typically developing individuals. What the research has demonstrated is that individuals with autism display much more severe deficits in the area of joint attention than that of other populations. This certainly comes as no surprise when you consider the social deficits of individuals with autism. Let me provide you with an example of an early episode of joint attention in this example. Let's say a mom or dad could be holding his or her young child outside and the child sees an airplane in the sky. The child may point to the airplane, emit an approximation or a sound that resembles airplane, and look to his or her mom or dad as if to say, "Do you see what I see?" Then, when the mom or dad looks at the airplane and makes a statement about the airplane, that interaction is reinforced, and there you have a joint attention interaction episode. From a behavior analytic perspective, there is always a basic three-term contingency in play for any joint attention interaction episode. That is, whether a person is an initiator or a responder, the three-term contingency applies. For the child or the initiator in that example I just mentioned, the antecedent stimulus is the presence of mom or dad and the airplane in the sky. The behavior is a shift in eye gaze, pointing to the plane and or approximating the word airplane, and the consequence is the social interaction there, the social exchange. For the responder or the mom or dad in this scenario, the antecedent stimulus is the child's initiation. The response is mom or dad looking at the airplane, thus acknowledging that child's initiation. And the consequence is, again, that social exchange that took place. So in some, it's not about the child wanting the airplane, but rather about sharing the experience of an airplane flying by with mom or dad. And while this is a very basic example of joint attention, it's important to note that research on joint attention has primarily been the focus of young children with autism. But as I mentioned earlier, joint attention becomes much more complex as we become older. For example, one could have a shared experiences with another person at a soccer game when a goal is scored. So let's just say two friends go to a game together. One friend could initiate a bid for joint attention by directing the other friend to look at the field when a certain player is about to score a goal. Once the friend looks at the field and perhaps makes a comment such as, "Yes, I see him, go," which reinforces that initiation, a bid for joint attention has taken place. While different, again, than the airplane example, what remains the same is the concept of joint attention that consists of the shared experience. There have been some behavior analytics studies that have effectively demonstrated sound experimental control and effective teaching procedures to teach joint attention, which is how this study came about to expand the literature and to teach very valuable social skills to adolescents and young adults with autism. For the study that I will now present to you, we were interested in teaching adolescents and young adults with autism to initiate bids for joint attention. However, we were interested to teach a skill not in a situation where there was an airplane in the sky, but more related to things or situations that we might experience every day, which I'll describe in the next slide. And this study really came about for two reasons. Number one, again, at the time of this study, prior research had only focused on joint attention skills in young children, primarily those who were 8 years of age and younger, to teach them to respond to joint attention under very salient, obvious conditions, for example, with an umbrella hanging down from the ceiling. And the second reason why the study came about was we noticed that the learners in our program would engage in social interactions, but they were not really attempting to draw someone's attention to something that was worthy of attention. So, 4 participants ages 17 to 19 participated in this study. The participants were taught to initiate bids for joint attention under 4 different scenarios. The first scenario, someone came in to a room with an interesting item, for example, a stack of movies. The second scenario, the second category, was the participant saw something interesting in the room when he or she entered the room. For example, there might have been a Halloween sign on display. The third category was someone delivered an item, for example, a package from FedEx or from UPS. And the fourth scenario was something unusual was taking place. For example, the carpet was being cleaned for some reason. During baseline, the materials and the room was already set up, but no prompts or rewards were delivered. During intervention, we had to teach the learners to look at the item or the event taking place, and then back to the social partner using written prompts and time delay. What's important here is that the learner had to first notice something was different in the environment, and second, draw the attention of the other person to that item or event. Both of these aspects, again, are critical components in initiating bids for joint attention. So, for example, if someone delivered flowers, that participant had to recognize that event was taking place and to share that experience with a social partner. Then we taught the participants to make a comment or ask a question about the item or event using script and script fading procedures. And again, script and script fading procedures, as described by McClanahan and Krantz, is an empirically validated procedure in which the written or audio scripts are used as models of language for individuals. When individuals are reliably imitating those scripts are then faded systematically from end to beginning until no scripts remain. In this study, we taught to a variety of different scripts, which helped to promote generalized responding. So in the flower example that I just described, a question such as, "Who do you think those are for?" would be an appropriate question to ask when flowers get delivered. After all, if flowers were delivered at a work setting without knowing who they were for, we will likely ask a similar question to that. We also wanted to ensure generalized responding was assessed in the presence of non-training stimuli and in untrained settings. We wanted to ensure that this would occur with different items and in different places so that the skill would be functional and can be applied across a variety of settings. So, for example, what if flowers were delivered to a teacher at school and to mom at home? Both are worthy of attention and inquiry. And finally, we wanted to ensure that joint attention was occurring when it should have and not occurring when it should not have. Again, flowers are worthy of attention, but someone filling up a cup of water at the water fountain should not really draw someone's attention to that. So discrimination is critical. The data that I'm going to show you in a minute was assessed via a multiple probe design across 4 participants, as you will see in the upcoming graphs. So what you can see in this first graph shows the percentage of opportunities with fully initiated bids for joint attention. You can see that during baseline, none of the 4 participants initiated a bid for joint attention. With the introduction of the intervention procedure, all 4 participants initiated bids for joint attention to a criterion level very rapidly once the 3-second time delay was introduced. Furthermore, at 2 weeks and 1 month following intervention, all 4 participants were able to maintain the skills to a criterion level of performance. For the purposes of time for today's presentation, I'm not presenting the graph that shows a variety of different language responses that the participants emitted, but what I can tell you is that all participants did emit unscripted language after the scripts were faded. Now, I said a few minutes ago that we wanted to assess generalization, and for that, we looked at whether the participants responded to items or situations that were never taught to. Again, during baseline, what you can see here is that the learners did not display any generalized responding. But when we intervene in the presence of training stimuli, what you were also able to see here was that generalized responding occurred in the presence of non-training stimuli and or situations that were presented. And again, generalized responding also occurred on the follow-up assessments 2 weeks and 1 month following the removal of the intervention. Lastly, I spoke a few minutes ago about the learners knowing when to display the social behavior and when not to. On this graph, the closed circles represent situations in which the participants should have initiated bids for joint attention, and the open circles represent situations in which the participants should not have initiated bids for joint attention. You can see that during baseline, participants did not initiate a bid for joint attention when they should have, nor did they initiate when they should not have. But they did engage in joint attention when they were supposed to, as you can see on the graph, which are marked by those closed circles. And they rarely initiated bids for joint attention when they were not supposed to, which again are marked by the open circles on this current graph. Ultimately, what you see here is an effective discrimination of skills. Can we go to the video, please? What you will see here is an example of two participants during the study, during baseline and following intervention.
Look at that.
Yeah, it's a Christmas tree. We brought it in for the holidays to decorate.
Cool.
Yeah, I'm excited.
What's that?
Oh, looks like we got a box of candy delivered.
That sounds good.
That's good.
Can we go back to the presentation, please? Thank you. So what you were able to see in the videos is that during baseline for both participants, neither was able to initiate a bid for joint attention, even though both of them noticed something was different in the environment. So they weren't drawing the teacher's attention to that item in the environment. Then, following teaching, both participants were able to initiate a bid for joint attention by identifying that there was something different in the environment and commenting about that item to the social partner. I'm also happy to report that these participants are still making those initiations. So as you can see, teaching to a variety of different social exchanges is important for all learners with autism. The study that we presented today to you was only intended to provide you with really a brief overview of joint attention. Please know that we could speak for days on the importance of social interactions and provide you with various examples of how we could go about teaching to those interactions. I hope you think about what we discussed today and incorporate it into your programming. I thank you again for your time and the opportunity to present to you today to celebrate the 15 years of the Institute for Child Development and the contributions that Drs. Krant and McClanahan had on all of us as professionals. Thank you.